You guys ready to get started? Okay, so today we're going to talk about cord blood banking, and I know that for most of you, this is like a really vague topic. We don't really talk about it, and our patients don't really ask about it. But when you have private patients, some of them sometimes tell you, oh, I want to collect cord blood, and then when they come for their delivery, they have this kit and they hand it over to you. And so sometimes you're like, oh, okay, well, what am I supposed to do with this? Exactly. And so you really don't want that to be your first time that you're ever looking at this, because then you're thinking, well, I hope I don't screw this up. So today we're just going to go over some of the basics about cord blood banking. And really, the point of this talk is for you guys to at least learn about cord blood banking, understand the procedure, the advantages and disadvantages, the different types of banks that you can use, so that you can counsel your patient and talk to your patient about it. So one of the major things is, when your patients think about this, or when you think about this, you want to know why people do this. And so when people are asked why they bank the cord blood, there's three major reasons that they give. One is they think that it's an investment in their child's future. They think that it's an investment in healthcare, and they think that it's a good investment into kind of research in the field. So that's kind of the recurring theme you hear when people are asked why they do this. So one of the first things we're going to do is we're going to hear kind of a story about a patient that actually got a cord blood transplant. And this is something that we can relate because we see plenty of patients with sickle cell.
I am 10 years old and I used to be sick with sickle cell anemia. I remember telling my mom I wish I could switch bodies with someone else because I thought if I switched bodies with someone else, I'd be happy and free and I wouldn't have pain. I was 7 years old when I got a cord blood transplant for my brother. I think it was about 1 month after the transplant, I started not feeling any pain. That must have been my second birthday. I was reborn again, so all the sickle cell and my nightmares were gone.
She is amazing, this girl. She is doing so well in school. I'm just overwhelmed. Her hair is so beautiful. She looks healthy.
I feel really, really great, and now I could just expect the future. And I was really happy that he was saving my life. He was happy that he was saving my life, and I was so grateful that I was able to get cured of sickle cell.
So that's one of the examples of the use of cord blood transplant. And when we look at the history of cord blood transplant, it's pretty recent. So the first transplant happened in 1988, and that was at Duke, and it was between two siblings, one that was affected with Fanconi's anemia. So there was this child, he was 5 years old, and at around the age of 2, they were doing some blood work and they noted that he was pancytopenic and that he had these other features of Fanconi's anemia. So he was tested, he tested positive, and so the family knew that that's what they were dealing with this child. Well, in that meantime, when they were doing all this workup and trying to treat this child, the mother actually became pregnant. So she got pregnant in June of 1987. And at that time, her doctors had talked to her about looking to see what the HLA typing was on this baby that she was carrying, and if that baby also carried the gene for Fanconi's anemia. So it got tested, and it was found to be a perfect match as far as HLA matching, and that it was negative for Fanconi's anemia. So they talked to her about this potential treatment with cord blood. And so after that, what they did was she delivered vaginally. They harvested the cord blood. At that time, Duke sent the cord blood to Indiana University School of Medicine, where they tested it and stored it. And then they got the 5-year-old boy ready for a transplant, and then they transfused it. And at the time, there was a case report put out in 1989. And at that time, this kid was doing well. He had no evidence of any kind of chronic graft versus host disease. And he was living a pretty normal life. So that was the first successful cord blood transplant that was done. After that, in the 1990s, especially here in the U.S., that's when these private and public cord banks started to pop up all over the place, and they started to try to create this network of cord blood. So in 1991, the first public bank was established in New York at the New York Blood Center. And after that, there's been others that have kind of popped up, but the one in New York was the first public bank. Then in 2005 is when Congress kind of got into the mix, and they passed this CW bill, Young Transplant Act, which enabled the funding for this continued growth of this National Cord Blood Registry. And today, more than 35,000 cord blood transplants have been performed, and it's been used for standard treatment in over 80 diseases. So we're going to kind of go through some of this and talk about the differences and advantages and disadvantages and whatnot. So when we talk about cord blood, you know, the thing that we're really looking at is the stem cells, right? These hematopoietic stem cells. And traditionally, we think about bone marrow transplantation when you think about patients that have these diseases that could be treated with stem cells. So the alternative now is this umbilical cord. And so when we compare it and talk about the advantages and disadvantages, we're really comparing it to the standard as far as bone marrow transplantation. So right, when we're looking at these stem cells, you have this multipotential hematopoietic stem cell that can differentiate into these different cells that we see. With the umbilical cord, what they find is that in the concentration, it has actually a richer supply of these hematopoietic stem cells than bone marrow does. Okay? But when you talk about the volume, you just don't get as much volume in a cord blood as you do from the bone marrow, right? You're kind of limited as how much blood you can get from the cord. There's also known to be a decreased graft versus host disease, and they think that you know, this is due to kind of the immature immunity that this newborn has. And so when you look at the lymphocytes in the cord blood, they're less immunologically active than in adults. So what are the major advantages? Well, one of the major advantages is that it's more rapidly available, meaning that with the cord blood, just like how whole blood is stored, it's frozen, it's cataloged, and it's stored kind of in a bank, right? And so if they find a match, they get the match, they thaw it, and they can transfuse it. Whereas with bone marrow donation, most of the time they have to do like a drive, or they look at the registry, they have to contact the patient. So the actual search takes about 4 months. Then they have to, you know, do the actual retrieval of the bone marrow and invasive procedure and things like that. So it's not as easy or as quick to get the stem cells that way. Another major advantage is as far as the procedure, it's not really invasive when we talk about the collection, right? Because you're collecting the blood from the cord and the placenta after the delivery of the baby, which really shouldn't affect your delivery or should affect the mom in any way. Versus, you know, the bone marrow retrieval is a very invasive procedure for people to do. Another advantage is that you have a high list of potential donors, right? So everyone that comes through an obstetric clinic is a potential donor. Versus, like we talked about before with bone marrow, it's a registry that people, you know, voluntarily participate in, or they create this drive looking for people that are willing to donate their bone marrow. So the pool of people that they're looking at is much smaller than the pool that you would be able to get from cord blood. We already kind of touched on that decreased risk of the graft versus host, right? Remember that immature immunity that this fetus has, or this infant has, as compared to an adult's blood and their stem cells from that. Like we said before, when you look at the lymphocytes from that stem cells in the cord blood, they are less immunologically active. And they also looked at the blood and has shown that there is either a decreased number or even an absence sometimes of the CD8 natural killer T cells. So the risk of having that kind of immune reaction is much less in these in that substance. Another thing is that with cord blood, they don't have to be a perfect HLA match. Because the cord blood does decrease the risk of graft versus host, it is possible to use not a perfect match or an unrelated donor to donate, even if, without having that increased risk of graft versus host. Whereas like bone marrow, you want to have as close as you can get to kind of decrease that rejection. So what are some of the major disadvantages? Well, one of the things is when you're looking at the transplantation, whether or not the transplantation is going to take or it's going to be effective. And so one of the things they look at is platelet engraftment. And there is a prolonged time to platelet engraftment, meaning the time that it's going to take for this to work. And this is related to the concentration of the cells in the actual unit. So classically, when they started using cord blood for treatment, it was used in children because they needed much less volume, and so therefore the dose was appropriate for a child because it's usually based on kind of their body mass. So one of the things that they've done to try to kind of get around that disadvantage is that now they're trying to look at things, instead of giving 1 unit of the cord blood, giving 2 units, so kind of doubling the dose to see if that helps as far as the platelet engraftment. And some of the studies have shown that it is improving as far as that. So this can be used as treatment in adults, but generally it's limited to children. As far as limited size, that's meaning that the actual dose that you have, the unit, is limited, right? When you collect your cord blood, you collect it after delivery, and so whatever you get from that placenta is kind of your finite volume. Whereas like with bone marrow, you have your donor there and you can collect how much you need. And it's really unethical to kind of go back to the baby or child or adult, whatever, that donated it and ask them for another unit or whatever at the time. Another disadvantage is that there could be some diseases that this infant may have that's not diagnosed, that gets diagnosed later in life. And so there is a risk that if this blood is transfused into somebody else, that could have the potential to potentiate that disease in the recipient. So those are the major disadvantages and advantages. Well, how do we do this? What happens to the blood? Where does it go, et cetera? So this is a quick kind of schematic drawing, right? So we deliver this baby, we collect the cord blood, then the cord blood gets collected, it gets taken to the facility, and the lab tests it. They test for infectious disease, they test for HLA typing, and then it gets stored. Okay, so that's basically kind of the cycle of this cord blood until it needs to be used. So like I said, you don't want to see this for the first time when your patient's like, I'm going to collect the cord blood for my baby. And you're like, yay. Okay, because they hand you this box and you're like, what am I supposed to do with this? So then you like open the box and you try to read the instructions and you're like, oh my gosh, I'm like worried about the delivery. Now I got to worry about collecting this cord blood and I don't want to screw it up. Okay, so this is an example of one of the cord blood kits. This is from one of the private banks called Cord Blood Registry. And you can see this here is the collection bag with the needle. Here's your instruction booklet. There's one like for you and one for the nurse. And then there's, they're collecting tissue, because you can also collect cord tissue, there's a little specimen container for that. So because I don't want that to be the first time you see like the procedure, here's a little kind of cartoon video from one of the other private banks that kind of walks you through the process so you have an idea of what you need to do to collect this blood.
Double clamp and cut the umbilical cord.
Oh, wow.
The cord or a prep sponge provided.
That's in the box, don't worry.
Seconds to dry. Close the white clamp on the Cell Sentinel cord blood collection bag tubing to maintain a closed collection system. Using caution, remove the cover of the collection bag by twisting the cover and pulling it from its base. Insert the needle into the umbilical cord vein. Open the white clamp on the collection bag tubing to start the blood flow. Lower the cell sentinel collection bag and allow gravity flow to collect as much blood as possible, about 3 to 5 minutes. When the blood flow stops, close the white clamp on the cell sentinel cord blood collection bag tubing while the needle is still in the vein. Remove the needle from the vein and retract the needle into the needle guard by pulling the tubing. When the needle is fully engaged into the needle guard, there will be an audible click. Pop the blue cap on the tubing vent to drain the blood from the tubing to maximize collection volume. Close the blue cap when the tube is drained. Tie 2 tight knots in the tubing to prevent blood leakage during shipping. Cut the tubing between the needle guard and the clamp and dispose of the needle in a sharps container. Complete the cell sentinel cord blood collection bag label and adhere to the collection bag. Double bag the collected sample in the 2 plastic biohazard bags provided. Seal both bags. Place the bags containing the cord blood into the BioCord box. Ensure the maternal samples are also collected, labeled, double bagged, and placed to the BioCord box. Do not seal the box. Return the BioCord box to the
This is the
family
most important
and
step.
instruct them to call BioCord to verify labeling and make arrangements for pickup. Keep the collection at room temperature.
Okay, so you see, it seems pretty simple if you're not like panicked that you have to do this. Like you don't find out the day that they're delivering or like right before you're delivering the baby. So it's good to kind of know ahead of time that you're gonna have to do this. So, kind of just a recap, right? So the thing is you're gonna deliver the baby, and you're not going to alter your routine practices. So if you do delayed cord clamping or you milk the cord or things like that, this should not interfere with your normal obstetric practice. Okay? Then at that point, you're going to clamp how they showed you. You're going to clean it, and you're going to, get the blood from the umbilical vein. Now, if something happens and say your placenta delivers, you still can collect the blood. Remember that it's collected by gravity. So you would have to do it as soon as you can after the delivery of the placenta, but you could still do it if you had to. Okay? And really the goal is to get at least 40 milliliters of blood. So, okay, so now that we have this blood, what do we do with it? You have 2 options. There are public banks and there are private banks. Okay? So when you look at the public banks, that's meaning like you're donating to society. So just like we donate whole blood, right? These banks are similar to that. Either the specimen gets discarded, it gets used for an unrelated transplant, or it gets used in research. Whereas on the other hand, if you choose a private bank, the ownership of this blood belongs to that patient or the family, okay? And that this can be used for therapy for a related family member, usually is what this is used for. So let's go more into detail about these public banks. So like we said, these public banks are for unrelated donation, okay, or allogenic donation. And it works very similar to that of the banks that collect whole blood, okay? And all of these are obstetric hospitals that are associated with this National Marrow Donor Program. So like we said before, initially this National Marrow Donor Program was for bone marrow transplants, but now it also includes umbilical cord blood. And this really is supported by either government funding, some private donations, or when the units actually get used, the money that was paid for the units gets sent back to the donor program. So on the patient side, some of the things that they think about is that this is free. They don't have to pay any sort of fee to donate their cord blood to a public bank. okay? Whereas when we look at a private bank, we'll look at the fees that are associated with banking for them. One of the things is if you want to donate your cord blood to a private bank, or a public bank, excuse me, is that you have to think about this well before it's time to deliver, okay? And so they really need to, the mother needs to contact the program anywhere between 28 and 34 weeks of gestation to kind of get everything set up, because it takes a while. You know, the mother has to go through kind of a history where she either meets or doesn't meet this medical eligibility criteria. And these right here are some of the definite exclusions, okay? So tattoos or piercing in the past year, twins or more, cancer diagnosis, or positive for hepatitis or HIV. One of the other things is that with cord blood, there needs to be an informed consent, and the informed consent needs to be done prior to the mom arriving to labor and delivery, okay? So the informed consent really needs to, the mom needs to understand what you're doing as far as collecting the cord blood, and she needs to understand that if something should arise, like an obstetrical emergency, you know, either to the mother or to the baby, that there's a possibility that you won't be able to collect this blood. Okay, and that she needs to understand too where the blood is going and what it can be used for. And then this Be the Match is kind of the organization that it's associated with that National Merit Donor Program, and it's the organization that kind of keeps the registries and promotes the donation to these public banks. So how do you donate to a public bank? Well, there's two different ways. Number one, you can look at the different donation sites that are across the U.S. And hopefully you live in a place where there's one if you want to do that, so it's easy. If not, there are some mail-in sites that you can actually donate your cord blood to. But again, you have to have some forethought about this and do this early on in pregnancy so that you can arrange all the different things. So if you look here on the map, this is the different sites of the hospitals that participate in these public cord banking, okay? And you can see with the legend here that some of them are only used for research, some of them do transplants with the National Merit Donor Program, some do other kind of transplants, so like private transplants, but these places would be the ones that you could donate through a public bank. So there are over 200 kind of in the U.S. Here on this map, it's a little bit harder to see, but there's really 5 mail-in places, right? There's like one in New Jersey, one in North Carolina, one in Texas, and 2 in Florida. So the caveat to these mail-in ones is that there's only 2 centers that take mail-in donations from outside of their state, and those 2 are the ones in Florida. And one of the ones in Florida only uses the cord blood for research, and currently it's only animal research. So those are some of the downfalls if you don't have a donation center near you. A public donation center, this is kind of what you can do with it at this time. So what about these private banks, or also family banks, right, that they're called? So really people bank their cord blood with a private bank, and it's really safe for a directed donation, usually either to the actual person that it was donated from or to a family, usually a sibling, because the sibling has the best chance of having an HLA match, and that chance is only 25%, okay, but that is the best chance. So with these private banks, there is a fee. So not only is there initiation fee for like the collection and the testing, but there's a storage fee, okay? And a lot of these companies will advertise to patients that this is kind of like some biological insurance for their child. Okay, and so here's some of the bigger cord blood banks, private cord blood banks that are around. So when we look at the cost, right, it's a little bit hard to directly compare costs because a lot of these things are put into different packages. But if we look in general at the initial cost plus 20 years of storage, because as far as cord blood bank, no one really knows what the true lifespan is, shelf lifespan. But this is kind of what you're looking at. So the top kind of 3 big cord blood banks, you're looking at anywhere between about, $3,000 and $4,000 for initial fee plus 20 years of storage. And this is only cord blood, okay? So there are other options with these banks, and you can bank umbilical cord tissue, you can bank placental tissue, because they believe that there's other stem cells that can be used from those tissues. However, those stem cells haven't been used in standardized treatment yet. So those kind of things that people are kind of saving as far as the cord tissue and the placental tissue are more kind of for like backup. And, so obviously if you say you want to bank cord blood plus cord tissue plus placental tissue, that increases your cost, okay? And another thing is you can look at, as far as storage, you can pay it year by year. You can pay, X amount of years at a time. Some places offer a lifetime payment. So depending on that, you can also end up paying more. There's one company, which is Viacord, that offers this special processing. It's called enhanced processing, where they say they take out all the red blood cells and they only have the stem cells, which makes it more amenable to this regenerative medicine. And so that's another special fee. So if you're looking at all these different options, as far as the range, you can look anywhere from like $1,400 to $7,500, depending on what services you want from these banks. There are different payment plans where you can pay like month to month. There's financing offered. So this is a very expensive situation, and especially from a patient standpoint, that you would want them to know what they're paying for and what they're getting. So when we talk about different therapies, there's really 3 categories that we look at as far as therapy, right? There's the standard therapy. We said that there are over 80 diseases or conditions that are currently being treated with standard therapy. There are different therapies that are in clinical trials currently, and then there are these experimental treatments. So, like we said before, you have 2 types of transplants. You have your autologous transplant and your allogenic transplant, right? So the autologous transplant, meaning that those cord blood stem cells that were taken at the time of birth goes back to that same baby or patient for treatment of whatever condition they have. Whereas the allogenic transplant, right, it could be related or unrelated, depending on the situation. So I'm not going to read all these to you, but there's an extensive list. And one thing I want you to pay attention to is, like, on these lists, there's a column. So it says allogenic and autologous, right? So if you think about the actual use of the cord blood for transplantation, the majority of the time, the transplantation is going to be for allogenic purposes, right? Because if the person already has the disease, it's very hard to treat them with the blood that already has the disease. So you have to have blood or stem cells that come from someone that doesn't have it. Okay, so here you can see, like, this list is different leukemias, myelodysplastic syndrome or pre-leukemias, and different lymphomas. And then it goes on. There's other, like, disorders of blood cell proliferation, like we talked about Fanconi's anemia, sickle cell anemia, etc. Again, there's more. Inherited disorders of the immune system and other organs, different solid tumors, different inherited metabolic disorders, right? So some of those inborn errors of metabolism that we learned about way back when. Then when you look at the clinical trials, there's a lot of different clinical trials that are currently underway. So remember that as far as a clinical trial, this is something that really hasn't been adopted as standard therapy yet, and depending on the phase is kind of depending on where they are with that current research, right? So if you wanted to look up the clinical trials, remember in the U.S. you can go to clinicaltrials.gov and it'll pull up a list of the different clinical trials that are going on in the U.S., and there's actually some internationally listed there as well. So some of the clinical trials that you can see, there's different neurologic disorders looking at autism, cerebral palsy, spinal cord injuries, different autoimmune disorders, Crohn's disease, lupus, MS, etc., cardiovascular disease, etc. So there is different things. They're also looking at clinical trials for gene therapy, some orthopedic things, and then some miscellaneous things like bronchopulmonary dysplasia, HIV/AIDS, etc. Then you have your experimental treatment. So currently, right, these experimental treatments really are done on animals that kind of represent the same diseases in a human. And these are some of the things that they're looking at. And in 2014, there was a review article looking at these different experimental treatments. And what a lot of these experimental treatments are is they're looking at the actual stem cells from the umbilical cord. So versus the cord blood, right, we said that those are hematopoietic stem cells, whereas the ones in the tissue are the mesenchymal stem cells. So they have a better kind of differentiation potential in that they can differentiate into different types of tissue. And so that's what these, a lot of these treatments are. And a lot of these studies are actually being done currently in China, and a lot of the results from these is pretty promising. So, you know, now that we know you can use it either in the actual donor, or you can give it to a related donor or an unrelated donor, what are the actual odds of actually using the cord blood? So for an autologous transplant, it's actually 1 in 5,000. And for an allogeneic transplant, it's 1 in 2,500. So the odds really aren't that high that you're going to actually use this blood. And you'll see that when we look at the recommendations from the different societies, that this is one of the things that, you know, should be kind of included in the counseling as far as what are the chances that we're going to actually use this. Another thing that we have to think about is legislation. And currently, there are 27 states that have cord blood education laws. And as you can see, Louisiana is actually one of them. Okay? And this legislation that we have here in the state of Louisiana actually follows the Institute of Medicine guidelines, which means that they mandate or they encourage physicians to educate expectant mothers about all forms of cord blood banking. Okay? And that this was initially proposed in 2008, and it was amended and was effective in 2009. So if we look at the Institute of Medicine recommendation, this came about because, remember in the history we looked at, there was that act that gave money to fund the program. Well, in that act, they asked the Institute of Medicine to do a study and look at what was currently out there and kind of come up with what they thought could be kind of the ideal structure and function of these national banking programs. So they looked at the Institute of Medicine for these recommendations. And from their report, they noted 2 things that were really important. They said, number 1, that the informed consent should be obtained prior to labor and delivery. And that, number 2, the donor should have clear information about their option. Okay? And so this is the actual statement that they go on to say. The committee strongly supports the Institute of Medicine report recommendation that women be provided with a balanced perspective and clear information in order to participate actively and knowledgeably in the choice of whether or how to donate cord blood. Informed consent is likely to include at least consideration of the following options: public donation, private storage, and disposal. Okay? Then this here is the actual Louisiana State Law, like what we should be doing as far as the education part on our patients. So Louisiana State Law says that all healthcare providers providing healthcare services to a pregnant patient by the end of the 2nd trimester or 28th week of pregnancy, which health services are directly related to her pregnancy, shall advise her of the options to donate umbilical cord blood following the delivery of a newborn child by providing standardized, objective information that is sufficient to allow a pregnant patient to make an informed decision on whether to participate in a public or private umbilical cord blood banking program. Okay? So, they also go on to say that you could use the information that's on the Department of Health and Human Services that they give. So this is the website that actually the Department of Health and Human Services put out regarding cord blood, and it kind of goes through kind of some questions and basics on cord blood banking, private, public banking, et cetera. So that's one of the things that you can use to educate your patients, and that you would be following the law. There are some other websites that kind of provide the same information, just kind of in a little different fashion. This AABB is a nonprofit organization that is dedicated to transfusion medicine and cellular therapy. So they have kind of this same kind of frequently asked questions for that. And then this Parents Guide to Cord Blood Foundation website is also another good resource. So I think you guys got a handout that has the websites, and then you also got, one of them is actually the little cord blood brochure that's from the Parents Guide to Cord Blood Foundation, and then one of them is actually from ACOG, which is their patient education materials on frequently asked questions for cord blood. So with that, what are the society recommendations? Okay, so like we said before, ACOG recommends that it shouldn't compromise your normal obstetric practice or neonatal care. Okay, and that, remember, should be included in your informed consent when you collect cord blood, that there may be circumstances where you're unable to collect it because of that. Again, you should list the advantages and disadvantages of both private and public cord banking. You should go over kind of with your patient as far as the current uses, and that it can be used for standard therapy in certain diseases, but not all. They also should know, like we said, as far as the odds that you're going to use it to treat the actual person that it came from is extremely low. And that they should not collect cord blood as a routine practice for this kind of biological insurance, okay? You want to document your informed consent, and obviously if you are a physician or a practitioner that have some kind of investment or you get money from one of these banks, that you need to disclose your relationship with that. The American Academy of Pediatrics also has a policy statement regarding cord blood donation. And again, so they really discourage the routine kind of practice where you're going to collect it and you're going to save it for future use in the family, okay? The only time it's strongly encouraged is like kind of our patient that we saw in the video, or like the patient, the first patient that got transfused for Fanconi's anemia, where there's already an affected child and then somebody gets pregnant, that they do encourage the testing, and if that patient could be a potential match for that you could go ahead and collect it and do a directed donation that way. And they also encourage the donation to the public banking. And then again, the same thing, they also discourage the routine biological insurance. So that's it.